Screening for prostate cancer may be one of the most controversial health topics that men will ever face. What is screening? Well, it means testing for a disease, in this case for prostate cancer, when there are no symptoms present. So you would have no idea that cancer is in your body. The screening tests are aimed at finding those cancers before they cause symptoms and before they've had a chance to spread. In the case of prostate cancer, it's far easier to cure a cancer that's found early than one that's found when it's very far advanced. And that's the main benefit of doing a screening. But the real proof or the real goal of screening is not just to find it early, but to change the natural history. In other words, by finding cancer early, you stop that man from dying from it or suffering from it in the future. And to tell for sure, proper studies must be done. For many years, men were told to get screened even though there was no evidence one way or another whether screening did indeed save lives. Now there's some information available, although it's still controversial. One study from Europe did show that routine screening starting at the age of 55 was able to reduce the chance of men dying from prostate cancer. The problem is that a lot of men were getting screened and even getting treated who did not benefit. In their study, about 1,000 men had to get screened over 10 years in order to prevent one from dying of prostate cancer. And a total of about 24 men had to get treated in order to save one life. So for those men who underwent the screening and the treatment who did not benefit, essentially they were getting a treatment that was not necessary. Now that wouldn't be a problem except that screening and treatment for the disease can cause side effects. The most common ones are problems getting erections and problems controlling urination. Men may leak urine as a consequence of treatment. And so before you proceed and before your doctor just routinely makes a decision to do your test, you should find out all the facts and make an active choice. The bottom line is, if your goal is to do everything possible to minimize the chance of getting harmed by prostate cancer, then you should get screened and you should get treated. On the other hand, if you're the kind of person who values your quality of life more and doesn't believe that the odds of benefiting are worth the odds of getting side effects, then the best thing for you may be not to get screened. Now, if you do decide to get screened, when should you do it? Some organizations suggest starting at age 40. The American Cancer Society says start at age 50 unless you're in the high-risk age group. That would include men with a family history or men who are African American. We also believe that there is some benefit to testing you over time. In other words, monitoring your PSA test, which is one of the things done, can be used to determine if something is changing. That's why some organizations suggest starting very early. If your PSA is very low to begin with and it gradually increases by a certain amount per year, you might benefit from having a biopsy. The problem now is that the blood test called PSA, or prostate-specific antigen, is unable to tell for sure if cancer is present. We used to think that a PSA level under 4 was normal. We now know that there is no such thing as a normal PSA. Even when the level is only 1, about 8% of men will actually have prostate cancer cells present. So the bottom line here is learn the facts, make an active decision, and hopefully you can participate in this choice so things are done to you only after you are aware of the risks and the benefits.